Approved uses. DURYSTA, bimatoprost intracameral implant, is a prescription medicine to reduce eye pressure in patients with open-angle glaucoma or high eye pressure. Important safety information. You shouldn't use DURYSTA if you have an infection or suspected infection in your eye or surrounding area. Do not use DURYSTA if you have corneal endothelial cell dystrophy, a condition in which the cornea has lost its ability to work normally and can cause vision problems, or if you have had a corneal transplant or cells transplanted to the inner layer of the cornea, or if the sac that surrounds the lens of your eye is missing or torn. Do not use DURYSTA if you are allergic to any of its ingredients. Please see additional important safety information later in this video.
My name is Monica, and I'm in Mission Viejo, California. I was diagnosed with glaucoma some time ago. Because of my family history of glaucoma, I am very vigilant about my vision care. Family is very important to me. I love to travel, and I would go frequently to Texas to see my grandchildren, and occasionally to New Jersey to see another daughter and her husband. My husband's still working, and I help him all I can in his business by editing and doing clerical work. One of my passions is cooking, and you can often find me in the kitchen trying a new recipe. I also enjoy exercise to keep myself fit. That's another way I'm proactive about my health. It was during a routine eye exam when the doctor told me I had glaucoma. It didn't surprise me because I have a family history of glaucoma. The doctor told me I had to control the high eye pressure to keep my condition from becoming worse. So the doctor said it was very important to keep my pressures under control, and he prescribed eye drops. It was challenging to remember to take them every night, and it was somewhat difficult to get them into my eye. In addition to all that, that's when I discovered I have a sensitivity to preservatives in medications. That's when my doctor suggested DURYSTA. My doctor told me there was a preservative-free option that could control my eye pressure for several months. He said it was tiny, and he would place it inside my eye where it would dissolve over time. I have a lot of confidence in my doctor, and I trust his recommendations. That's why I was eager to try DURYSTA. It was so straightforward, and it was over before I knew it. It has met my expectations. Since receiving DURYSTA, my doctor has told me my eye pressures remain under control. I like knowing that I'm getting the medicine I need and that DURYSTA's there doing the dosing for me. Recently, I was able to take a trip to Texas to see my children and grandchildren. Not having to remember to take my drops at night was just one less thing for me to deal with on that trip. I would definitely encourage others to try it. It's made such a difference for me. Maybe it'll make a difference for others too. I would say ask your doctor about DURYSTA. For me, the experience was great.
DURYSTA may cause side effects involving the cornea, including increased risk of loss of cells from the inner layer of the cornea. You should not receive DURYSTA more than once in each eye. Use DURYSTA with caution if you have a limited reserve of the cells lining the inner layer of the cornea, or if you have narrow or obstructed iridocorneal angles. DURYSTA may cause swelling of the macula, the center spot of the retina. Use DURYSTA with caution if your eye does not have a lens, if you have an artificial lens and a torn posterior lens capsule, or if you have any risk factors for swelling of the macula. DURYSTA may cause inflammation inside the eye or make existing inflammation worse. DURYSTA may cause increased brown coloring of the iris, which may be permanent. Eye injections have been associated with infections in the eye. It is important that you contact your doctor right away if you think you might be experiencing any side effects, including eye redness, sensitivity to light, eye pain, or a change in vision after an injection. Your doctor should monitor you following DURYSTA administration. The most common side effect involving the eyes reported in patients using DURYSTA was eye redness. Other common side effects reported were feeling like something is in your eye pain, being sensitive to light, a blood spot on the white of your eye, dry eye irritation, increased eye pressure, a loss of cells on the inner layer of the cornea, blurry vision, inflammation of the iris, and headache. Please see full prescribing information available at DURYSTA.com.